This is Elizabeth Harding. I'm one of the community ministers at Second Unitarian Church of Chicago, and today I'm going to talk about Hospice 101. So let's talk about what hospice is and what it's not. Hospice is high quality, compassionate care that is offered at the end of a person's life. So if you have a chronic condition or a life-limiting medical condition, hospice is an organization that can help you and your family prepare for the end of your life, for your own mortality. Some hospices have rooms, a house where you can go at the end of your life if you need care that you can't receive at home. Most often, people choose to have hospice at home. And so what hospice is a medical program, a benefit offered through the federal government. When many people are 65, they choose to have Medicare health insurance through the government. And they have Medicare A, Medicare B, Medicare D, which covers medications. And hospice is actually a choice that the patient makes. The patient signs a piece of paper that says, I want to be on hospice. And what they do is they're telling the federal government, hey, can you please put aside my Medicare A and draw from the other pot marked H, the hospice pot, Medicare. And that is how hospice is paid for. What do you get when you sign up for hospice? So the first part, much like palliative care, is that you are talking with your doctor and you have this life-limiting condition or this chronic condition that you know will change as you get older. And they say, we have tried every curative treatment under the sun for your particular condition. And at this point, we cannot offer you a curative attempt. But what we can offer you is quality of life, dignity, and a team of people who will make sure that every day is the best day that you can make it. And if you decide that that is what you want to choose, or let's say that you've been sick for a really long time and you've tried everything and you're sick of going to doctor's appointments and you're really tired of spending your time in hospitals and you just rather would be at home with your family or in your retirement community with your friends, what you can do is have your doctor fill out an order for hospice, and you can pick which hospice you want to work with. The hospitals in the Chicago area have hospices. There are several non-for-profit hospices. There are several private hospices. And you can choose which one you want to work with, but you can call them and they will set up an appointment with you to have a nurse come out and do a physical exam, look over your medications, talk with you about your goals, figure out exactly what you would like to use hospice for. And it's a big decision, but it's a really great program. So with hospice, you get to use multiple team members. You get the relationship with a nurse, the hospice physician who's always available to you but does not replace your doctor, a social worker, a chaplain, and many times a volunteer. In addition, they also have a certified nursing assistant. So all of these people are going to be calling your house and they will want to set up appointments with you and they will want to get to know you. And it's a little overwhelming at first, but they're really terrific people. So you can say, I would really like to meet everybody once, and then I would like to figure out what I want to do. The nurse has to come every week. I'll tell you that right away, because they have to make sure that your medications are in place and that you're doing okay. They have to take your vital signs every week. It's one of those compliance issues with the Medicare that funds hospice. You can ask the social worker to come once a month. You can ask the chaplain to come once a month. You can ask them to do phone calls. but everybody needs to meet you at least once at the beginning. It's a big help to them because then they know how to best take care of you and your family. So I'll say that again. You get to work with a hospice doctor, a hospice nurse, a social worker, a chaplain, a CNA, certified nursing assistant, and often a volunteer might be available to you through a hospice program. So what are all these people going to do? Well, the nurse, as I talked about, is going to check in with you once a week about medically how you're feeling, how to treat your pain, how to treat any questions that you might have about your medical condition, about what it might be like to die physically. They're really good about providing information to you and your family to know what to look for. The social worker does an amazing amount of stuff, I have to tell you. When I was a chaplain with one of my hospices, one of the things we did was that we helped someone move from independent living into a nursing home. We helped him get rid of all of the belongings that he needed to let go of. We helped him think through the process and accept the idea that things were going to change. Social workers can write letters to families if there are family members who live far away and need time off to take care of their loved ones. They can write FMLA, Family Medical Leave Act forms. They can figure out how to help a patient find someone to take care of their pets. They can talk with the kids in the family and the adults about all the feelings they might be having about having someone choose hospice as their medical care. The certified nursing assistant does a lot of the practical and, in fact, a lot of the heavy lifting. So they will come several times a week to help give someone a bath. They will help teach family members how to care for their patients at home. They know all sorts of tricks about getting people in and out of the tub and the shower, how to help change sheets without making a person uncomfortable. The certified nursing assistant can come up to 5 times a week. They often come 3 times a week. They often come early in the day. So that's, you set your own schedule. The role of the chaplain is actually to be a really good listener. They're not there to proselytize. They might be there to share their faith tradition with you if you ask. But I got declined a lot when I was a hospice chaplain because everybody was afraid that I was going to proselytize and not listen. But that was my role. My role was to listen and help people think through all the big questions, all the meaning of life questions, like why is this happening to me? What is going to happen next? We can talk with people about setting up their memorial service. We can do all sorts of things. So the role of the volunteer is to help the family get a break. So a volunteer can come in and sit with a patient while the family member runs errands or goes to the doctor or does whatever they need to do to take care of themselves, which is really essential because if you are a patient, you want the people around you, the people who are taking care of you, to feel like they get a little care time too. They're better caregivers when they take care of themselves. The hospice physician is always available. They usually need to make an appointment to visit with the patient. It's called a face-to-face visit every 3 months. And what that means is that the doctor is saying, yes, this person is still eligible for hospice. So they're going to be looking for weight loss. They're going to be looking for a change in functioning, like their daily living. They're going to be reading all of the notes that the nurse and the team put together. They're going to be attending the care conferences that the team has once a week about every patient. And then they sign a piece of paper that says, yes, this person is still eligible for hospice. So a lot of times I get asked, how long can a person be on hospice? As a bereavement counselor, it was my job to read the notes that every team member had after a patient died. So the longest time that I had someone on hospice was for 11 years. I know that many people think that hospice is for a very short amount of time when a person is very close to dying. But if a person has a life-limiting condition or a chronic condition, and the hospice team can see that they are declining very, very slowly, they can be on hospice as long as they need to be. They just need the doctor to recertify their care every 3 months. So hospice, as I said, it's paid for by the government. Many private insurances now have a hospice benefit. Pretty much every hospice I have ever worked with has a provision for people who cannot pay anything. You know, those funds are given by donors and people who feel that hospice is an amazing thing. So the goal of the hospice team is actually to extend your life as long as possible. The idea being is that if you're comfortable, if your pain is managed, if your dignity is paid attention to, if you are taken care of, you will live longer. And statistically, this has proven true. We always have a spike when someone signs up for hospice. They spike because they are so much happier. Everything is being taken care of. They don't have to worry about so many things. And there are people who graduate from hospice. That's how we term it. You know, if you're improving enough, if you gain enough weight, if you are feeling like, you know, you don't need hospice services, you can always sign out. You can always sign the revocation papers. And then if your illness changes, you can always sign back up again. It's a pretty amazing government benefit. And there are lots of people who lobby for it because they don't want the government to take it away. So again, the focus of hospice is to manage your symptoms: physical, spiritual, psychological, social, the things that you need to put in place, like getting your will together, all those things. Hospice team will help you do that. They will also help you pick out a funeral home, or if you decide to be cremated, an organization that does that. Again, when the doctor recommends hospice, what they're looking for is someone whose life-limiting medical condition or chronic condition is not going to improve, that it's only going to get worse, that their quality of life is only going to get worse, and that they have 6 months or less to live. Now, as I said before, we had a person who was on hospice for 11 years. So that 6 months is just the doctor's best guess, given their information about your chronic medical condition or your life-limiting medical condition. I have had plenty of people be on hospice for longer periods of time. 11 years was the longest, but I had several patients who used hospice, the hospice benefit, for 3 years or 4 years. One of the goals of hospice is to keep you comfortable wherever you're living, to avoid hospitalizations. So if you have a symptom or a side effect that you're surprised by, you call the hospice at 2 a.m. instead of going to the emergency room. It's one of the wonderful things about hospice. I have so hospice is not always a place, it is an organization. Some hospices have continuous care rooms or a building. Journey Care in Barrington has one. You can have in-hospital hospice with North Shore or Amita or Loyola. They all have what they call GIP, people who are too fragile to be moved, but they have elected the hospice benefit. Rush has an inpatient hospice program. So hospice is also great because in addition to all of the staff I mentioned, they often have other staff who provide care. Those people might be massage therapists. They might be physical therapists. They might be music therapists or art therapists. They might have trained bereavement counselors, grief counselors. The Medicare requires every hospice to provide bereavement care for up to 13 months. And it depends on what the hospice wants. That is the minimum that they have to provide. They have to provide bereavement care. The hospice gets to choose how that bereavement care is provided, whether it be support groups, whether it be phone calls every couple months, whether it be mailings like newsletters about grief, whether it be in-person counseling sessions. Every hospice is different, but they have to provide bereavement care. Where can hospice be? So hospice can be anywhere you need it to be. It can be in your own personal home. It can be in an independent living facility. It can be in an apartment building. It can be in a skilled nursing facility. It can be in a hospital. It can be in a freestanding inpatient unit. It can be in an assisted living facility. So what hospice is an extra layer of care. Remember that umbrella I talked about. And the idea is that hospice would work with all of the teams that are already in place in your life. They would work with the people in the nursing home to make sure that your medications are taken care of. So Medicare also pays for medical equipment and medications that are specific to your hospice diagnosis. So if you are depressed as a result of your chronic medical condition or your life-limiting medical condition, they will help you decide if antidepressants are the right choice for you. So they will provide all the medication. They will provide you a wheelchair. They will provide you with a bed that inflates to reduce the risk of bed sores. Excuse me, they will provide you with cushions, commodes, anything that you might need during your time in the hospice program. Some families already have medical equipment, and that's fine. They can choose to use their own medical equipment. But most hospices provide the staff, the medications, the medical equipment, and round-the-clock care. So if you have a question at 2 in the morning, there's always a nurse on call. You can always call somebody. You can find out. Who uses hospice? So the important thing to know is that it is not just for patients with cancer. That is one of the common thoughts about it. People with heart disease use hospice. People with breast cancer. People use dementia. People with advanced lung disease. People with progressive neurological disorders like Parkinson's or Lewy body dementia. People with renal failure or acute strokes. These are all people who would have life-limiting or chronic medical conditions that would mean that they could use hospice. In the Chicago area in the 80s, hospice was originally started for people with AIDS, and then it expanded to people with cancer. And now we are understanding that hospice works best actually when everybody gets to use it. So the focus of hospice is about living your best life as long as you possibly can. It is not about hastening your death. Hospice is not going to put people to sleep. It is not just about morphine, although morphine is a really great drug that has been around for a really long time and is one of the best pain medications out there. There are lots of choices about how you can deal with your pain in addition to medication. You do not have to have a PULSed form or a DNR form to enroll with hospice. But one of the benefits of having those forms put together is that you can have, your team knows exactly what you want. So as I said in the advanced directives video, it is really helpful to have all those forms in place, even if you don't have a chronic or a life-threatening or a life-limiting medical condition. It is not about giving up. Contrary to popular opinion, it is not about giving up. It is not just for the last few days of hospice. I mean, the last few days of your life. One of the most common things I heard all the time was, oh, I really wish we had signed up earlier so we could have used all of the services. You people are so awesome. So if you are at a point with your chronic medical condition or your life-limiting medical condition and your days are not enjoyable. That is the big thing. Your days are not enjoyable, or you're losing weight all the time, or your medications are not up to par. That is the time to talk with your medical professionals about whether or not hospice is a really great, or a palliative care would be a really great choice for you. So again, I'll say it, who is eligible for hospice? Anyone who has a chronic or life-limiting medical condition where the prognosis is 6 months or less is eligible for hospice care or palliative care. When you sign up for hospice, your doctor fills out the order, okay? The hospice gets the order. The nurse comes and does their evaluation. Then she shows her evaluation to 2 doctors, and 2 doctors have to agree, yes, this person is eligible for hospice. And you have to use a Medicare certified hospice provider, or you have to use your private insurance benefit, or you have to be eligible to receive funds from the hospice. Commercial insurance usually follows Medicare guidelines. If you are on Medicaid, you can still use hospice. They will follow the Medicare guidelines. So I had a number of patients who were on Medicaid and on Medicare, and what Medicare covered was the hospice benefit. Medicaid covered their bed at a nursing facility. There was a very small amount of money left over for the patient to use for their own personal wishes. I hate this part of the medical system. I wish I had better news for those of us who are on Medicare and Medicaid, but it is really important to know that Medicaid does follow Medicare guidelines, and you can use hospice if you are on Medicaid. There is also the opportunity for private pay. Care is never declined on ability to pay. So what does hospice not pay for? So hospice will not pay for a private caregiver. If you decide that you cannot take care of your loved one for whatever reason, you will have to pay for that private caregiver to come. And I have found for our families that it was cheaper to hire one 24-hour caregiver than to hire more than one for different shifts. It just kind of often worked out that way. Room and board. Medicare will not cover room and board at a nursing facility. So if a family has a loved one in an assisted living facility or in a skilled nursing facility, and they say, yes, this person is eligible for hospice, yes, we want to sign up for hospice, the family is still responsible for their room and board financially. It will also not cover treatment for curative. It will not cover curative treatment for an illness. So let's say you sign up for hospice and you're loving your team and you're having a great time, and 6 months later your doctor calls you and says there's this clinical trial that you might want to try. So you can sign the revocation papers just like in palliative care, and you can go on your clinical trial. And if it doesn't work, you can always call up the hospice and say, hey, I want to come back. And they will come out and do the whole thing again, evaluate you again, and you can sign up for hospice. So some ins and outs about hospice. If you have a pacemaker, okay, a machine in your heart that helps your heart keep a steady rhythm, some hospices can help you die comfortably by using a magnet to make the pacemaker not work anymore. You do not have to go to the hospital and have the pacemaker removed. You can die with the pacemaker still in your body comfortably. You have to talk to the hospice about that being a medical choice that you want to do. And what that means, what the risk is that the person who has the pacemaker has to understand that they may not survive the next event, the next heart attack, the next heart event, whatever they have. That may be what causes their body to not work anymore and for them to die. Some hospices will help if you are really struggling with pain, really struggling, like you're reporting a 10 out of the 1 to 10 scale, and your quality of life is miserable, they will work with you to find an acceptable level of pain medication for your life. It is important to know that at some times families have to make the decision between the patient being pain-free and asleep versus having pain and being awake. And that is a really difficult decision for families because they know they don't have a lot of time with their loved ones. But many people, when they get to the point where the person has to choose between being pain-free and asleep and having pain and being awake, they will allow the person to be asleep because it's so uncomfortable. The team of people that I worked with at both hospices really loved what they do. They really loved their patients. They always went above and beyond. One of the hospices I worked with had a very soft spot for veterans. There were veterans who didn't have any family. And I witnessed the hospice team adopting the patient and just making sure that their every day was special. There were volunteer coordinators that would send them cards for Mother's Day, Father's Day, their birthdays. The social workers would get together and make a list of all the patients' birthdays and make sure that they got acknowledged. The other hospice that I worked for had a music thanatologist, and they would come out with their harp and they would play music that was specially attuned to the patient's breath. And that meant that the patient died at a much lower pain level because they were so calm. The patients that I worked with were really amazing people. They didn't want to talk about dying. They wanted to talk about living. And in fact, every time I brought up dying, they would get mad at me. One patient I had kicked me out. She fired her entire team except for the nurse. And she really just wanted to focus on walking on the beach and living every day. And she didn't want to think about her life. And she asked me to come back after a while, which was great. The other amazing thing that hospices will do is that they want everyone to have a plan for after death. So they will have everyone fill out information about their funeral home or their crematory. And it really helps the family to know ahead of time what to choose. It makes a big difference. So as difficult as that conversation might be, it is really important to find one that works for you. The Neptune Society is fine. Elegy Cremations in Chicago is good. There's a whole bunch. And if you can't afford a plot, or if you need to fly a body home to another country, the hospice team will help you do that. These are people who are really dedicated to making sure that your every day is full of love and care. Chaplains will attend to death and say a prayer if that is what the patient and family want. They will also help you call the funeral home. They will help you get all organized after a person has died. It is a very powerful time to be in a family's life, and hospice is a really amazing organization. The people that I worked with also had the most amazing things that they did in their free time. They would go ballooning, they would go skiing. The mentality of working for hospice has really taught people how, the preciousness of time. And so they really use their time fully. And they really help families and patients learn how to use their time fully. So again, if you have any questions about hospice that you want to ask privately, I'm always available. I'd be very happy to set up a time or a Zoom chat or a phone call. This is just a way to provide a broad overview of what hospice does for families. And I want to reiterate, no matter your ability to pay, there is always a way to cover hospice. I'm trying to think of what other things I can say about hospice, but if you have any questions, I look forward to the Q&A sessions over Zoom. Thanks.